My name is Kelly Patterson, and I am the clinical nutrition educator here at OmegaQuant. Today, I'm going to be talking about our vitamin D test. Let's go ahead and get started. All right, so vitamin D is a fat-soluble vitamin, and we primarily synthesize vitamin D through sun exposure through our skin. Sun exposure with UVB light converts cholesterol in our skin to a usable or to a form of vitamin D that is then transported to our liver. We can also get vitamin D through food and supplements. I'll talk about this a little bit later, but there are very few foods that have naturally high levels of vitamin D in them at all. So it's not typically a significant source of the vitamin D that we get. Supplements can be a significant source, obviously, but the sun is the primary way that we get vitamin D into our systems. Once vitamin D is synthesized in the skin, it's not in a usable form. So it has to be transported to the liver to be changed into a usable form of the main circulating vitamin D metabolite. Okay. Once that is circulated, it goes into our kidneys and can be targeted or sent throughout the body to be utilized for many different functions as well. So there are many factors involved in vitamin D synthesis, especially because it is such it is reliant on our outside environment. And there's a lot of ways that our outside environment can affect our ability to synthesize vitamin D. So obviously, the more time you spend indoors, the less vitamin D you're going to be synthesizing. You're not getting sunlight exposure at a level that's necessary or any at all. Skin surface exposed. If you're outside in long pants, long sleeves, hats on, anything covering up your skin, but really long pants and long sleeves. If you don't have a significant amount of skin exposed, you're not going to be able to synthesize enough vitamin D, really, no matter how long you're outside for. Skin pigmentation as well too. The darker your skin is, the more melanin you have in your skin, the less able you are to synthesize vitamin D through sun exposure. You still are able to. It just takes more sun exposure, a longer amount of time in order to produce adequate amounts of vitamin D. Those with fairer skin produce it a lot quicker, a lot easier, and are less likely to be at deficiencies with shorter time spent in the sun. Altitude, the higher up you go, because there's less atmosphere, you get more of that UVB exposure. The more sun exposure, or the more UVB rays you have exposure to, the more vitamin D you will produce. And then sunscreen. So sunscreen is remarkably effective at reducing vitamin D synthesis in the skin, which obviously is good and bad, right? We use sunscreen to protect against UV damage to the skin, especially for those who are fairer skinned, but really anyone's using sunscreen. But the problem is that even a low SPF, so if something as low as SPF 8 can reduce the conversion of vitamin D to its usable form by greater than 90%. So sunscreen works really well for preventing sunburn, and we want to use it, especially to prevent sunburn. However, it can reduce the synthesis of vitamin D in your skin to almost zero. It's not completely zero, but it's very, very close. So this is a really interesting calendar from Grassroots Health showing location and where you are latitude-wise in the world and how that can also affect your ability to synthesize vitamin D. It makes intuitive sense that the higher and very, very low latitudes, certain times of the year, you will not be able to synthesize vitamin D no matter how long you're outside for. There may not be enough time in the day or enough direct sunlight no matter what. So if you look at the United States there, during certain parts of the year, if you're in the same latitude line as New York, during certain parts of the year, no matter how much time you spend outside, even if you're wearing shorts and a t-shirt, January and February probably wouldn't be doing that, but you're probably not going to be able to synthesize any vitamin D with that sunlight. It's just not direct enough. The UVB rays are not direct enough, and the UV index is not going to be strong enough to get you the vitamin D that you need. Looking through kind of the different months of the year, in certain parts of the year, that June, July, and August, you're going to be able to do that. But again, the lower latitudes, because of the tilt of the earth, you're not going to be able to synthesize that vitamin D. So this is another thing to take into account. The lower latitude you live in, if you're in the southern half of the United States, you're more likely to have pretty decent, ability to produce vitamin D most of the year, but it might require a little bit longer of time. So the orange bubbles are going to need a little bit more, for 20 minutes for lighter skinned folks, 60 minutes for darker skinned folks. And in the dark red bubbles, that would be just 10 minutes for lighter skinned or 45 minutes for darker skinned. So you may have to increase the amount of time depending on the time of year. And sometimes of year in some places, no matter how much time you spend outside, you're not going to be able to synthesize vitamin D. So this is also important to take into account. If you live in one of these places where a good chunk of the year, at least quarter of the year, you're not going to be able to synthesize vitamin D, this may be something you'd be more concerned about. So vitamin D as well, sun exposure versus supplements, okay? So sun exposure we know helps create vitamin D, but how does sun exposure do versus a supplement? So this study from the Journal or Clinical Nutrition in 2020 showed that supplements are actually remarkably effective at increasing your vitamin D levels. They're a bit more effective than sun exposure, actually quite a bit more effective than sun exposure compared to a placebo. They're all, better. And this was a study using 500 international units of vitamin D daily. So when it comes to supplements, if we know that they are working really, really effectively to raise our vitamin D levels, there's a couple different forms of supplements out there. So which is the best to be used? There are two main types of vitamin D. There's vitamin D3 and vitamin D2. So vitamin D3 is cholecalciferol, okay? This is the form of vitamin D produced by animals. So when we produce vitamin D through sunlight, we are producing vitamin D3. This is the form that we utilize well. Vitamin D2, ergocalciferol, is the form of vitamin D that is produced by some plants. So it's a plant-based vitamin D. Really, the only plants that produce this are mushrooms, and only mushrooms that are exposed by UV light. So there's a little bit of, yes, mushrooms do have some vitamin D, but they have to be exposed to UV light during their growing process in order to produce that vitamin D. And not all mushrooms are. So if you're going to the grocery store and you're trying to buy mushrooms, like trying to get your vitamin D up, they don't necessarily all have vitamin D in them. They're not all do, because they haven't all been exposed to UV light. Both are safe to take, but as you can see in this chart here, vitamin D3 is much more effective in humans at increasing that serum level, okay? Much more effective. So we see that go up much higher than in the D2. The D2 is the little circles, and the D3 is the triangles there, that top line. So when we're trying to do a supplement, if you can, or if we're trying to bump up our levels, where vitamin D comes from, sunlight is great, but again, if you're fair skinned, you may not want to be putting yourself in the sunlight too much, although 10 or 15 minutes a day, not too big of a risk. And a supplement, it can be really safe, really effective, and does a similar thing at raising those vitamin D levels, and especially a vitamin D3 supplement. So why do we care so much about vitamin D? Now we've talked a little bit about how we make it and how to get those levels up. So vitamin D does a lot of different things in the body. It is a cofactor and is utilized in several different processes across the body. Vitamin D has a been a big topic of research in recent years. And so, there's a lot of areas where vitamin D seems to play a really integral role. Really, the top two most important are calcium absorption and muscle function. So, vitamin D, probably most people are familiar with vitamin D being important for bone health. And the reason is because vitamin D helps with calcium absorption. It helps our bodies or bones absorb calcium and build bone. Okay. So if you're someone, especially for women, if you're someone who's taking calcium supplement, hoping that, you want to prevent things like osteoporosis down the line, but you're not taking a vitamin D supplement and you could be vitamin D deficient, the calcium probably isn't going to do too much. So vitamin D is really, really important there. Vitamin D also plays a really important role in muscle function and muscle regeneration. There's a lot of steps into the processes of how this works, but skeletal muscle and even some, organ muscle and heart tissue, vitamin D is important for the regeneration of that, especially skeletal muscle. So vitamin D, this is sort of more of a recent finding that skeletal muscle, vitamin D is really important for skeletal muscle, and especially if you're more of an athlete, someone more active, this is really, really important, but it's important for everybody too, especially as we age. So these are some studies showing bone mineral density in folks based on their serum vitamin D levels. And we can see bone mineral density changes in folks who have lower vitamin D levels. And so that's where we get a lot of the information on bone density and why vitamin D is so incredibly important. And what's interesting as well too is that these changes are also seen in younger folks as well. So I think a lot of people think that, oh, bone health is something we worry about when we're a lot older. And yes, it's true, we want to worry about that when we're older, but it's very, very important to consider, especially when you're younger. You stop putting down and building bone mass and adding bone density sometime in your 30s. After that, we're losing a lot of bone mass, or we're trying to maintain our bone mineral density. So when you're young, you really want to focus on kind of keeping those bones, building as dense bones as you can, so that when you're older, you're not losing massive density you don't have. So there also appears to be a link between vitamin D and pregnancy outcomes. There's a bit of a question as to how exactly this works, but there appears to be a pretty strong link between preterm birth, so babies being born early, and low vitamin D levels. So babies seem to be more likely to be born early prior to 38 weeks when the mother has low vitamin D levels. There are also some interesting low birth weight statistics, and this is probably because these babies would be born early, same for small for gestational age. So that's a little bit more interesting. So these babies are even small considering, compared to other babies born at that time. So vitamin D in pregnancy appears to have some strong links as well too. It's not exactly clear 100% how that mechanism works, but it is interesting nonetheless. And we also know that vitamin D is in breast milk as well too. So for expectant moms and those who are breastfeeding, vitamin D is really, really important. If you're vitamin D deficient, it could affect the time when you give birth, and it also can affect the amount of vitamin D that ends up in your breast milk as well too. So vitamin D and cardiovascular health, this likely has something to do with vitamin D's effect on muscle function, but we do see an increase in cardiovascular events and cardiovascular mortality when we have those low vitamin D levels. So when we are deficient in vitamin D or really insufficient, we start to see higher relative risk for a cardiovascular event, meaning heart attack or stroke, and cardiovascular mortality. Again, if you're more likely to have a heart attack, you're more likely to die of it as well. from and this was a meta-analysis from the American Journal of Clinical Nutrition in 2017. It was a pretty large study. And so this is a pretty good correlation there between vitamin D and cardiovascular health. So what's the status of vitamin D again? Why do we care so much about it? If it's so important, it's a really important vitamin. It's also pretty tricky to synthesize. And there's pretty good chunks of the world that have low or borderline low vitamin D levels. And a lot has to do with our geography. The farther north you live, and again, those seasons where you're not able to synthesize as much vitamin D, the more likely you are to be, insufficient. So we see vitamin D levels of over 30 nanograms per milliliter as being optimal. And there's very little of the world that has kind of average levels like that. You see the ones that we have data for are, again, more along the equator. And then we also see it in some nations that eat a lot of marine products, a lot of fish, because they do get some vitamin D that way as well. So as I said, the desirable levels for vitamin D optimal is between 30 and 50 nanograms per milliliter. There's some research to say that for some populations, like third trimester pregnant women, a desirable level might be really smack dab in the middle of that, 40 nanograms per milliliter. But we feel pretty comfortable saying that for most people, we want to be somewhere between that 30 and 50 range. If you're below that, we probably want to be considering how we get those vitamin D levels up. And vitamin D is interesting because you can have too much of it. It's very rare to see excessive levels of vitamin D. You'd have to be over 100 nanograms per milliliter. This is usually seen in people who are taking very, very high dose supplements for a very, very long period of time. And there are some health effects that you can see from taking excess vitamin D, typically like kidney and liver effects because of the way that vitamin D is processed by the liver and the kidneys. You can end up seeing things like kidney stones, calcifications, again, because it's increasing that absorption of calcium. So just want to be careful of getting too much vitamin D. Long-term serious consequences can come out of that. So we really want to try to stay in that 30 to 50 nanograms per milliliter. We want to be watching our supplement doses, and that's something that you want to talk to your healthcare provider about if you have any concerns. So what are some symptoms of vitamin D deficiency? They can range, but typically if you've got a deficiency for a longer period of time, we can see things like fatigue. That's probably the number one symptom that a lot of people report, is just feeling really tired all the time for kind of no reason. Bone pain and aches is another one. And this one makes intuitive sense, right? Because your bones are not getting adequate material in order to recover, regenerate, repair. You can get a lot of aches and pains. Muscle cramps, muscle weakness as well too. Again, these tend to be symptoms that are a little bit, longer term things that if you've been deficient for a long period of time, you might see some of these, but fatigue can be one that shows up a little earlier. Mood changes, depression. Some people report just a depression, just sort of low mood, not feeling great, having very little energy, and that can be a symptom of vitamin D deficiency as well. And again, all of these make intuitive sense. You're not getting the ability to absorb that calcium, so that bone pain, and again, the effects on muscle function as well. So again, causes, we're just not getting out in the sun enough. We're not getting out in there enough. We're not getting out for long enough periods of time, or we live in a place where 6 months out of the year, we couldn't, we work indoors, we live inside. So for a lot of us, especially, I would like to know if you are a shift worker, if you're somebody who works a night shift or things like that, you are really at risk for vitamin D deficiency because you may never see the sun, or very, very rarely. Inadequate intakes via diet. So again, like I mentioned, there's not very many naturally occurring sources of vitamin D, not high enough anyway to make an impact on our health. It's pretty low. There are some, again, mushrooms and some fish that can have vitamin D in them. but you have to eat a lot of them in order to get enough, and that can cause other issues in your diet. There are certain drugs and medications that can affect vitamin D levels as well. Anything that will affect your ability to absorb fat can affect vitamin D, because again, vitamin D is a fat soluble vitamin. So we got to get out in the sun more, or we might need to take a supplement. So people who are at higher risk for deficiency or insufficiency, infants are at high risk. Like I mentioned, there is vitamin D in breast milk, but if mom is deficient or insufficient, baby is not going to get enough through breast milk. Formula is fortified with vitamin D, or some of it is anyway. The infants may need to take a supplement as well. So a lot of breastfed infants need to take a vitamin D supplement. But all the more reason for mom to get her levels checked and make sure that she's getting adequate amount of vitamin D. Pregnant women, again, older adults, typically because we're not spending as much time outside and they just don't have the ability to synthesize as efficiently as they used to. Folks with darker skin, again, if you're not spending during certain times of the year, even if you live in an area where the sunlight is direct enough, if you're not spending upwards of an hour outside in shorts and a t-shirt, you may not be synthesizing enough vitamin D. So if you have darker skin, very dark skin, you are at pretty high risk of vitamin D deficiency. People have had weight loss surgery. So anybody who has had a weight loss surgery that changes the absorption of their gut, you're not going to be able to absorb vitamin D, especially if you're taking it in a supplement. People with a BMI over 30, not exactly clear on how this, could affect. It could be because of having a higher amount of adipose tissue. Vitamin D can end up being stored that way and not utilized properly. But people with a BMI over 30 tend to have more likely to be vitamin D deficient. People with kidney or liver disease, because of where vitamin D is processed and metabolized, vitamin D deficiency is likely in those situations. And anybody who spends all day inside. And I would add to this, shift workers, if you work a night shift, if you're a nurse or something like that, and you're working a night shift, you are most definitely going to be, vitamin D deficient. If you never are outside in shorts and a t-shirt, if you're not able to expose that skin the way you need to, that would be another thing that causes vitamin D deficiency as well. All right, so our vitamin D test is a plasma dried blood spot vitamin D test. So I'll talk a little bit about how that works and how our dried blood spot collection works. This is a little bit of nerdy lab stuff, just showing that our dried blood spots are accurate and valid versus collecting from, a big blood tube. So we can get a smaller amount of blood and test it in our lab, and it is as accurate as if you were to go to a different lab and get a huge, big, inconvenient vial of blood drawn. So ours is accurate. It's also stable, so you can put that drop of blood on the card that you send to us and send it in the mail and have no concerns over it being safe and stable in the mail at time and temperature. No problem when we test it in the lab. It's not going to have gone bad or anything like that in the mail. And this is just, again, a little bit of nerdy lab stuff. Our tests are repeatable, so we're getting good quality results with these this type of testing. So just so you know. All right, so we talked a little bit about how vitamin D is affected, how we create vitamin D. Really, the two things you can do to improve your vitamin D levels: spend a little bit of time in the sun and potentially take a supplement. Okay, so we want to try to spend 15 to 20 minutes of unprotected, i.e. no sunscreen, kind of wearing less clothing. Sun exposure can be enough if you do that daily to increase vitamin D levels to the desired range. I put an asterisk on this, and I would say this is if you are lighter skinned. If you are darker skinned, you probably need closer to 45 minutes to an hour. Okay. Again, this varies a lot depending on geographic location. Talk to your doctor before you do this, especially for us lighter skinned folks. You are at higher risk potentially of getting sunburned. And so there are costs and benefits to doing this. You just want to, make sure that we're considering all of those. So talk to your doctor before you make significant changes. I brought this chart up again because I just want to reiterate that if you're in certain parts of the world, it doesn't matter, how much time you spend out in the sun. If you're, in New York in November through February, it doesn't matter if you go out in shorts and a t-shirt every day, even if you're light skin, dark skin, doesn't matter. You're probably not going to be able to produce enough vitamin D. Okay. So, we may consider dietary vitamin D. Again, I mentioned there's not very many foods that contain vitamin D naturally. Some fatty fish do, so salmon, tuna, mackerel. I would highly recommend people eat these fish more often for many, many reasons. We talk a lot about omega-3s here at OmegaQuant. All of those are great sources of omega-3s. They're also great sources of vitamin B12 and vitamin D as well too. Mushrooms and egg yolks have a small amount of vitamin D, and then there are products that are fortified with vitamin D. So most milk in the United States is fortified with vitamin D for that very reason. And then supplements. So supplements, the world of supplements is vitamin D supplements. The only recommendation I can make is a vitamin D3 supplement is most likely going to be effective in increasing your vitamin D levels. Doses can range widely. When you go to the shelves, you can find anything ranging from a couple hundred IUs, international units, to 10,000. And so it's really important if you're considering taking a supplement or changing a supplement and you don't know and you're really confused, talk to your doctor to see what would be right for you. You can take your OmegaQuant results and say, this is what I got. Is this appropriate? If you want to do a little bit of your own research, check out our calculator at OmegaQuant.com. We have a section of calculators. One of them is a vitamin D calculator where you can go on and put in your levels from your results from your test, and it will give you an idea of how much vitamin D you need to be taking. Okay. All right, so how do you do our tests? They're really, really simple and easy. These are the instructions exactly that will come with your test. It's as simple as getting all your equipment out. The first thing you need to make sure you're doing is registering your test kit at OmegaQuant.com and registering that barcode. If you don't do that, we don't know who to send the results back to. So you go ahead and do that, fill out your card. Then you take your blood sample, which is just a simple prick on the side of your finger. You only need a couple of drops of blood on the card. You put that back in the envelope and send it back in the mail to us. It's so, so simple. And again, safe to put in the mail, and we can use that dried blood spot to test your vitamin D level with similar accuracy to doing a whole big vial of blood, and much easier because you never have to leave your house. You can do it right at home. And in a couple of weeks, you'll get your results back. So how do you get a test kit? Go ahead to OmegaQuant.com/shop. Go ahead and order one of our test kits. We have a whole bunch. Vitamin D is one of them. Make sure you register your kit, collect your sample, mail it in. And then we usually get results to you in about 2 weeks. Results will be sent electronically. So we'll send you an email with your results in it. And then you can also get them through our portal as well too. So it's real simple and easy to do. And you get your results with a little bit of an explainer at the bottom. And that's it. Thank you so much for listening about vitamin D.